Hello, I'm Chris, and our topic tonight is proton pump inhibitors. Does your morning coffee give you heartburn? Do you suffer from bloating? Constant headaches? Tonight we will discuss proton pump inhibitors, the controversial #1 treatment for these symptoms.
Thanks, Chris. Tonight we continue this week's focus on health. Tonight's theme, proton pump inhibitors, otherwise known as PPIs. Since their inception, this class of drugs has gone on to become one of the most commercially viable classes of drugs in the world. Development began in the late 1970s, early 1980s, with omeprazole being the first commercially available drug in 1988 in Europe. Today, the World Health Organization lists proton pump inhibitors as an essential medicine for humanity.
In the studio we have Dr. Maria Garcia, who will explain the action mechanism of proton pump inhibitors.
So proton pump inhibitors are a type of drug used for treating stomach ulcers, peptic ulcer disease, acid reflux, and the like. And they work by reducing the amount of acid produced by your stomach. All of our stomachs produce acid to aid in digestion and to kill bacteria. Our stomach lining is specially made with natural mucus barrier to withstand this acid attack. However, smoking, our diet, and a bacteria called Helicobacter pylori can interfere with the regeneration of the stomach lining and can therefore lead to the damage of the stomach lining and forming an ulcer. So when it is healing and there is a continuous production of acid, it can be a very slow and very difficult process. To be able to intervene in people who are experiencing these problems, we would give them drugs that interfere with the production of the acid. The first drugs that were able to do so block the chemical messenger molecule histamine, or also known as H2 antagonists like Zantac and cimetidine, but they were only partially effective. On the other hand, proton pump inhibitors were the next generation of drugs that are dramatically effective because they block the final pathway of this acid production. So that's pumping of protons by protein pumps in the inside of the lining of the stomach. They permanently inactivate these protein pumps, and to get the stomach to start producing acid again is to regenerate those protein pumps. These protein pumps are only found in the stomach, so there's not big of a worry that these drugs might target other areas in the body, especially when taken long term. These drugs have good efficacy and a great safety profile.
So do the benefits outweigh the risk? Next up, our pharmacist Matthew Carter will explain the effects of their long-term use.
So despite their great safety profiles, proton pump inhibitors have a number of common acute and a variety of potential long-term side effects. Some patients may experience nausea, vomiting, headaches, or gas. These side effects are considered common, however, in pharmaceutical terms, common usually means approximately 1 to 2% of all patients experience them, so it's not too much to worry about. As for long-term side effects, there is little data to suggest PPIs cause significant damage associated with long-term usage. Elderly and malnourished patients are at a higher risk of vitamin B12 deficiency when using PPIs over a longer period, so screening is recommended for patients within those risk groups. There have been recent findings that suggest there is an increased risk of contracting colitis, so the benefits and risks should be weighed up in immunocompromised patients and those with life-threatening enteric infections. With respect to pregnancy, all PPIs are considered Category B, which means limited studies have been completed on them to determine whether they are safe to use. Antacids such as Mylanta are the preferred choice of drug in pregnancy, followed by H2 antagonists, and only then should PPIs be considered. The most important thing to manage excessive acid production in conjunction with PPIs is to reduce the triggers that cause the issue. Coffee, alcohol, smoking, spicy citrus and carbonated foods are all common triggers for people with reflux, so it would be in the patient's best interest to avoid these high-risk groups. This means a lesser likelihood of the patients having to take PPIs long-term, and therefore exposing themselves to potential adverse effects.
We hope you found this information useful. We'll see you again next week with another pharmacology topic.